This is a bit of an impromptu video on a lovely Wednesday afternoon on the East Coast, morning on the West Coast. I host a podcast called Physicians Who Lead, and it's been a great vehicle for talking to physician leaders and physicians that want to go into leadership roles and things of that nature, whether it be medical directors, chief of a program, or eventually chief medical officer. And it's interesting because I was also reading some data online about how chief nursing officers and CEOs have a higher retention rate than chief medical officers, and it was about 25% higher. And this kind of started a conversation on LinkedIn with several physician leaders, and it led me to think that there are several reasons that systematically we are creating this lesser retention and potentially creating less effectiveness of physician leaders. And it leads me to think based on conversations I've had. So this is anecdotal. It's really based on 20 years of my experience, not an actual research study or anything like that. And often there's two factors that are challenging. And, the first one is not necessarily preparing the physician for what the role is going to look like, right? And, everybody has preconceived notions of a role before they go into it. And I think somehow not, defining what the role is and what the expectations are. And, that could be a simple thing as pace, right? Understanding that as you move away from a small environment such as the clinical space, where you've got several patients and staff, and you're the clear leader, and you're leading by direction, right? Like we even call them physician orders. So moving from that scenario to an environment where you've got a lot of different disciplines that you interact with, and moving towards leading by influence is a drastically different skill set, right? And sometimes we have to help people understand that the pace is different, right? And communicating that the pace of change is not going to be the same. It's not going to be the same as changing the course of care for a patient when you're talking about implementing something system-wide, hospital-wide, and things of that nature. And then I think the secondary thing that also came up in a lot of these discussions is supporting the physician as they move it once they're in the role, and identifying that it is a change of mindset, a change of view, and a change of perception and things of that nature. And physicians are brilliant people, but they are trained one way and stuff like that. And a lot of physicians go on to do MBAs or MHAs, or they join the American Society of Physician Leaders and get training and stuff like that. There's actually a physician that I've been messaging with who wrote a book on physician leadership, and in reading through it talks about a lot of those things as well. So I think we need to identify the role and set great expectations that are transparent and sincere. And then I also think we need to support the physicians while they get in the role, and over the first 6 months, to identify the culture change and the challenges that come with it. So what at Avery Professional Group, what we do is we actually dovetail consulting services with our placements. So the physician is supported through the first 3 to 4 months of their tenure to try and reduce negative retention and increase retention. Most of the literature says with coaching and onboarding support, you can increase retention by 25%. So I think that's a sizable number. The other piece is that with coaching and onboarding support, you can have somebody up to a maximum efficiency 70% faster. So again, there's a heavy return on investment of investing in your leaders and ensuring that they have the tools to do the work. So I want to kind of cap this video at around the 5-minute mark. So if you are looking for physician recruitment and executive recruitment in Canada or the US, I'm always happy to talk. I've been lucky enough to make placements on both sides of the border, and and um, and lead the creation of teams. So take care and have a great Wednesday.